So therefore, investigations. This is about gastrointestinal system investigation, taking into account all the different types of gastrointestinal disease. This is not about any particular disease investigation dekha. Entire gastrointestinal system ke aage ek sathe dekha. Therefore, it can be a stomach duodenal disease, it can be intestinal diseases, it can be liver hepatobiliary diseases, it can be pancreatic diseases. So before we actually start gastrointestinal system, let me put it this way, যে ইনভেস্টিগেশনের কথা যখনই আমরা বলবো, we will take off those 4 pillars কিন্তু. So that part keeping in mind, we shall apply that knowledge for almost each and every system. So let's start with gastrointestinal system. So this is about any gastrointestinal disease, and to build up a general idea about investigating a gastrointestinal disease. So let's take them one by one. Blood is one pillar. So blood test for gastrointestinal diseases. Now in many gastrointestinal diseases, blood loss হয়, either blood loss হয় or হয়তো blood loss হচ্ছে না, অন্য কোনো ভাবে hemoglobinের formation gets impaired. So therefore CBC remains one important investigation. It doesn't give us a diagnosis of the disease, it obviously gives us the effect of that particular disease. তেমনি সিবিসির মধ্যে হিমোগ্লোবিন যেমন কমতে পারে বিকজ অফ মেনি জিআই ডিজিজেস, তেমনি জিআই ডিজিজেও অফেন ইনফ্লামেশন অর ইনফেকশন হয়, therefore টিসি ইনক্রিজ করতে পারে. সো সিবিসি ইজ ডেফিনেটলি ওয়ান অফ দ্য রেলিভেন্ট ব্লাড টেস্ট, যেমন ইউরিয়া, ক্রিয়েটিনিন, সোডিয়াম, পটাশিয়াম. দিস শুনেই মনে হয় কিডনি. However, even in GI diseases, urea creatinine বা electrolyte disturbance might occur. So therefore urea, creatinine, sodium, potassium. Then you come to intestinal diseases. Albumin gets absorbed in the intestine and therefore albumin. So this is about mainly intestinal diseases, solo intestinal diseases blood investigation. Now gastrointestinal system obviously includes hepatobiliary as well. So let's discuss blood test of hepatobiliary diseases. And you all know, এইটা শুনলেই মাথায় আসে LFT, which is equal to bilirubin, OTPT by SGOT, SGPT, other liver enzymes, তার মানে alkaline phosphatase, as well as gamma GT, also known as GGT. যেমন SGPT is also known as ALT, SGOT as AST. Now we will spend few minutes on this liver function test. Now liver function test, although this is equal to liver function test, but the most important blood parameters, this is the most important blood parameters which tells us about the function of the liver, is not these blood tests. The most important liver function related blood tests are those tests which tells us about the synthetic function of the liver, the tests which give us an idea about the synthetic function of the liver. Liver synthesizes albumin. Liver synthesizes all the clotting factors, and therefore clotting parameters are very much liver function tests. So therefore clotting factor set tests are the thrombin time INR and APTT. Now these are the most important blood parameters or blood tests which tells us about the functional status of the liver. These tests are important, but these tests obviously tells us, these tests are not useless, they are definitely important. এক কথায় বললে, these tells us that it's a diseased liver, it's an unhappy liver. But how unhappy or how badly diseased the liver is, সেটা বলে how bad is the liver condition, সেটা আমাদেরকে বলে এই টেস্টগুলো, because the synthetic function when starts to get jeopardized, it means liver is in a bad shape. So therefore, for a doctor, liver function test is equal to not only bilirubin, SGOT, SGPT, alkaline phosphatase and GGT, also albumin, P-time, INR and APTT. Now, these tests, just quickly to go through them again, because how do they help us? We need to know how to interpret a liver function test, or also often, not often, at times also called liver biochemistry. Now, এইটা bilirubin, SGOT মানে enzymes, SGPT and alkaline phosphatase and gamma GT. These parameters when abnormal obviously tells us that it's probably a diseased hepatobiliary system. Hepatobiliary, not only liver, biliary disease, these parameters get deranged. So one importance is definitely they tell us it's an unhappy hepatobiliary system. Number two, this is very important. The pattern of these tests gives us an idea about the type of the disease. And what do we mean by type of the disease? Because there are two types. One type is এইটা যেখানে it's a predominantly hepatocellular disease, whatever may be the etiology, it's a hepatocellular problem. The other type is which is a predominantly biliary problem, also known as cholestatic disease. Now, from the pattern of these tests, we can differentiate at times whether the liver function test belongs to an hepatocellular disease patient or a biliary or cholestatic disease patient. The current bilirubin, both we have got conjugated and unconjugated. In cholestatic diseases, cholestatic pattern is predominantly conjugated bilirubin increases. It's predominantly conjugated hyperbilirubinemia. Whereas here in hepatocellular diseases, more or less proportionately, both the fraction increases, therefore unconjugated as well as conjugated, both more or less proportionately increases. Whereas here, predominantly or disproportionately conjugated fraction increases. Number two, enzymes, SGOT, SGPT, significant rise indicates it's a hepatocellular problem, whereas here in cholestatic diseases, SGOT, SGPT is often not significantly high, but this point we shall come back again. ঠিক যেমন alkaline phosphatase, gamma GT, এই এনজাইমস গুলোকে বলা হয় cholestatic markers. So therefore, in cholestatic diseases, alkaline phosphatase and gamma GT are often significantly high, whereas these enzymes are not significantly high in hepatocellular diseases. But this part we need to understand a bit more. In many hepatocellular diseases where the disease has involved the hepatocytes, or it's a hepatocellular disease, at a side by side, not very significant hoito, but even in hepatocellular diseases, একটা degree of cholestasis does occur. Conversely, in many cholestatic diseases, যেখানে primary disease is a cholestatic disease, biliary disease, even in these diseases a degree of, so these are the primary diseases, and এই দিকটা হলো এই primary diseaseটার জন্য kind of a secondary effect. Let's try to understand this. So in hepatocellular diseases, there is a secondary degree of cholestasis. Temni in many cholestatic diseases, as a secondary effect, a degree of hepatocellular derangement does take place. Clear? So, যার হেপাটোসেলুলার কোনো ডিজিজ হয়েছে তারও এসজিওটি এসজিপিটি যেমন ইনক্রিজ করছে, তেমনি বিকজ অফ দ্য সেকেন্ডারি cholestasis a degree of rise of alkaline phosphatase often occurs. Similarly, that primary cholestatic disease has happened because cholestatic disease predominantly alkaline phosphatase and gamma GT increases. However, because of that secondary to hepatocellular derangement, খানিকটা rise of SGOT, SGPTO does occur. So the bottom line is, be it an hepatocellular disease or cholestatic disease, all the enzymes increase. So therefore, from the results of these enzymes, how do we tell whether the disease is primarily a hepatocellular disease or a cholestatic disease? Because the question here is, in both the variety, all the enzymes increase. Now that is possible because যেটা তখন বলা হচ্ছিল যে in cholestatic diseases, now listen to this sentence carefully, both যেগুলো cholestatic markers they increase, hepatocellular markers gulo increase. However, look at the arrow. The rise of these এরা যতটা বাড়ে above তাদের normal range, so the degree of rise above তাদের normal range is much more than these. Similarly, in hepatocellular diseases, all of them will increase. However, often the degree of rise of SGOT, SGPT above তাদের normal range, that rise are much more than the rise of alka phos and gamma GT above তাদের normal range. So, quickly, cholestatic disease or hepatocellular pattern of disease, if you want to differentiate by the liver biochemistry, one here it is disproportionately or predominantly conjugated bilirubin rise to of all the enzyme. If you compare, then we see that alkaline phosphatase and gamma GT rise is much more significant than the rise of SGOT, SGPT above the normal range. So you compare to what extent alka phos and gamma GT has jumped versus to what extent SGOT, SGPT has jumped. And what we see, alka phos and gamma GT rise is much more than SGOT, SGPT rise above their normal range. Whereas in hepatocellular, it is the both conjugated as well as unconjugated, both increase. Here, enzymatically, what we see is the reverse. That means SGOT, SGPT rise is disproportionately more than alkaline phosphatase and gamma GT rise. Now, talking about this SGOT, SGPT, ALT, AST. There are different types of hepatocellular diseases. They are basically a marker of kind of hepatocellular inflammation. Greater is the degree of inflammation, more will be the rise. So therefore, you will see more spectacular rise of SGOT, SGPT in acute hepatitis, because a inflammation, and more severe is the inflammation, and often in acute hepatitis, whatever the etiologies are, in acute hepatitis there is, well, spectacular rise of SGOT, SGPT. So this is about liver biochemistry and an overall understanding of that. So this is about liver function test. So now if we go back here, the liver function test, but from these tests, you can come to these two conclusions. Key number one, that it's a diseased hepatobiliary system. It's a diseased hepatobiliary system. Number two, we can also get an idea about the pattern or type of the disease, whether it is a predominantly hepatocellular pattern or predominantly a biliary pattern. However, none of this tells us how badly damaged the liver is. To know that, you will have to see a patient there, যাদের এই parameters গুলো are deranged. Please do remember albumin, prothrombin time INR, APTT, synthetic functions of the liver, because synthetic function of the liver acts as a prognostic marker. So worse is the synthetic marker test gulo, worse is the condition of the liver. So a doctor definitely sees these results, but the doctor gets more worried when these things are deranged. So therefore, conventionally speaking, LFT বলতেই যেগুলো মনে পড়ে, বিলি, SGOT, SGPT, alkaline phosphatase and gamma GT. From these, we know, we can come to a conclusion that it's a diseased hepatobiliary system. We can also come to this conclusion, khanikta holo, whether it's a predominantly hepatocellular pattern of disease or a biliary বা cholestatic pattern of disease. But these diseased persons, how bad is the liver, how bad the liver is, a badness of the liver বুঝতে গেলে তোমাকে দেখতে হবে লোকটার অ্যালবুমিন কত, লোকটার পি টাইম আইএনআর এর কি অবস্থা, পেশেন্টের এপিটিটি whether deranged or not, because these indicate synthetic function of the liver, and if they are deranged, that means synthetic function is deranged, which is, so synthetic function is deranged, and that derangement, this derangement is a bad sign. This derangement, it's a bad sign because this indicates it's a failing liver. I repeat, I know probably you are getting bored. They cannot tell us whether it's a failing liver or not. They can tell us it's a diseased liver, but they tell us whether it's a failing liver or not, whether it's a failing liver or not. So this is about liver function test and an overall introductory discussion about liver function test. If we now go back to original discussion where we started, so GI system, so blood investigation, intestinal disease related blood investigations are these, hepatobiliary is these, and then we have got pancreatic disease, so pancreas related blood tests are to pancreatic enzyme blood level. Therefore I know the area is slightly clumsy, so let me put it here. So GI system blood test, say stomach, duodenum, intestinal diseases, hepatobiliary diseases, pancreatic diseases. Now just to remind you again, just a small thing. Now that disease, small intestinal or large intestinal or gastric or duodenum or hepatobiliary or pancreatic, we are talking about the organ related diseases. Now if you now consider why that particular organ is diseased, that means the etiology of that particular liver dysfunction or etiology of pancreatic dysfunction or different types of intestinal or stomach diseases. There are plenty of etiologies, but then etiology wise liver disease may have 15 etiologies. However, all of these patients are liver disease patient. So the basic understanding of liver function test is useful for each of these etiological diseases. So what we are trying to do, we are trying to acquire this basic principle. So stomach, duodenum, intestinal diseases related blood tests are CBC, urea, creatinine, sodium, potassium, because these again electrolyte disturbance can occur, biochemical disturbance, these are basic biochemistry. এই দুটো টেস্টকে henceforth we shall call as kind of universal blood test. They are applicable for almost each organ or system. Albumin is also related to intestine. Liver function test, LFT, again including P time, INR, APTT and albumin. PT, INR, APTT, albumin. And you will see in many liver diseases, yes, CBC problem what? So this remains an hepatobiliary investigation as well, because you get the effect. Then liver disease can lead to jeopardized biochemical environment. So urea, creatinine, sodium, potassium. Pancreatic disease, amylase, lipase. When you read pancreatic diseases, we will see these are pancreatic disease related blood tests. But how come? It's almost like what SGOT, SGPT is for liver disease. The amylase lipase is a marker of itis, pancreatic inflammation. So that indicates pancreatitis. But even in many pancreatic diseases, apart from pancreatitis, there are many other pancreatic diseases. So therefore, for not all of them, amylase lipase is a blood test. Amylase lipase is specifically for pancreatic inflammation diagnosis. তেমনি pancreatic disease অনেক সময় CBC gets altered. Because of pancreatic disease, biochemical environment gets altered. So therefore, এইগুলো pancreatic disease অনেক সময় পড়াতে হয়. So CBC including হয়তো CRP inflammatory marker, urea, creatinine, sodium, potassium, these are kind of universal blood test. Even in other organs we will see that these tests does help us to, well, not probably to diagnose the disease, but however, because of the disease এদের একটা alteration আসে. So therefore we know those alteration by doing these tests. So this is about blood. Then we come to the local material or regional material of GI system. I think in the note GI এর আন্ডারে যেখানে এগুলো লেখা আছে, this heading has been omitted. So therefore this we have seen যে GI related local material can be feces, so examination of the feces, examination of the ascitic fluid when it appears, ascitic fluid. So therefore GI system related local or regional investigation, local material হচ্ছে এই দুটো হতে পারে feces and ascitic fluid. Then you come to imaging of the GI system of all these organs, and yes, X-ray abdomen, USG abdomen, CT abdomen, MRI of abdomen, and there is an MRI particularly to see the cholangiopancreatic areas, which is nothing but MRI of that area. That is called MRCP, which is nothing but MRI of a cholangiopancreatic area. MRI abdomen means whole abdominal MRI. MRCP is kind of a local MRI, a শুধু এই এরিয়াটার MRI. Then this is if it is external cameras, internal camera. So therefore internal camera is endoscopy, and we have got upper GI endoscopy and lower GI endoscopy. And this we have discussed. Each endoscope, যে এরিয়াটাতে endoscope is going inside, there is a limit beyond which the camera cannot go. So endoscope যখন ঢুকলো, যে সিস্টেমেই ঢুকুক না কেন, it will not probably be able to visualize, to capture the photograph of the whole system or area. So this is not an exception here as well. So upper GI endoscope, the camera can go up to a second part of duodenum. Then the lower GI endoscope, এই যদি anus দিয়ে colonoscope ঢুকলো, this is anus, rectum, sigmoid colon, then descending colon, this is transverse colon, this is ascending colon, this is ascending colon, ileocecal region, and then the small gut. If this is the lower GI endoscopic camera, it can go up to AEOP, and therefore lower GI endoscope can visualize up to ileocecal region. There is a special endoscope which is rarely done, but it is a special endoscope, a small capsule which a miniature camera. The patient swallows that capsule, it traverses through the entire GI system and gets then purged out with stool, and then that capsule is collected, everything is recorded by that miniature camera. And this is a very sophisticated variety of endoscopy. sophisticated variety, this is called capsule endoscopy. But for you, it is not imperative that you should know this. It's not a must know knowledge. So this is about endoscopy, and to quickly revise this endoscopy diagnostically will help us in two ways. One, visualization of the respective areas. So visualization, and number two, একটু পরেই দেখবো biopsy করতে help করে. So endoscopic biopsy from the stomach, from the colon, from the cecum. So therefore this is imaging, and then we go to biopsy of GI system. If required, it can be done endoscopically, endoscopic biopsy. It can be done radio image guided biopsy. That depends on from where you're going to do the biopsy. If the organ is an organ which is endoscopable, stomach, duodenum, colon, lumener bhetore lesionta, so then it can be endoscopic biopsy. Whereas liver biopsy, just to give an example, peritoneal biopsy, these biopsies are often done a radio image guided biopsy. So this is about the overall discussion of gastrointestinal system related investigations.